Greetings. I'm Dwight Harken, and I'm delighted to have this opportunity to tell you about Mended Hearts and its great development. Back in 1951, when heart surgery carried an overriding fear of dying, 4 of my post-operative patients were sitting in a lounge at the famed Peter Bent Brigham Hospital, now Harvard's Brigham and Women's Hospital, and they were exclaiming over the joy of survival, the joy of being alive. And they talked to each other about how wonderful it would be to have an opportunity, or have been for them, had they had an opportunity to have somebody come and visit them and show them living proof that heart surgery could be successful and one could be happy and well after surgery.
I'm tremendously privileged to be a participant in the whole cardiac surgical kinds of programs, starting before my life when my dad started doing it. And he recognized the value of a patient who had heart disease and then had a therapy for that, to go back with the understanding of what that process was and communicate to potential patients who were thinking about proceeding with some kind of aggressive cardiac therapy. And that's always frightening. We all recognize that your heart's an important organ in your body, and when you have something wrong with it, the idea of having it fixed can be frightening. And so the beauty of the Mended Hearts is that they have gone through this frightening process, and they, with a realistic understanding of what that process is personally, can communicate that to a prospective patient in a way that simply can't be accomplished by a nurse or a pharmacist or a surgeon or a cardiologist. It's just so much more meaningful. You speak the patient's language by communicating what the options were and the process was. The psychological stresses of initially recognizing that you've got a cardiac problem, then going through the tremendously confusing various alternatives and options, then undergoing the therapy and then recuperating and recovering from it can be tremendously complex. The Mended Heart was a major communicator, translator in that very constructive process. I can tell you how I feel if I had an operation, but it's so much more persuasive if I show you how I feel. And to have somebody psychologically holding your hand during that process and helping you understand what the complexities are, what the options are, and what the likelihood of success is extraordinarily helpful to everybody, to the patient, to the nurses, to the surgical team, to the families. And patients who, in my view, have a mended heart as a companion during the process simply do better. The secondary advantage accrues to the patient who is now helping other people. Some people recognize that the most gratifying, rewarding, exuberantly happy thing you can do is to help somebody else. And this is what the Mended Hearts know. This is what the Mended Hearts do. And so not only are you helping the patient, you're helping the family, you're helping the surgical team, but you're helping yourself. You're giving yourself the opportunity to help others, which has got to be the most gratifying thing you can ever accomplish.
Many of our patients are worried and concerned about themselves or their family members, and to have a Mended Hearts person come into the cath lab and put the patient at ease is just really a fantastic thing for our patients. Not only have I seen this firsthand as a physician with a myriad of patients, I've also seen it with my family members. My dad, my father-in-law, my mother-in-law all had cardiac catheterizations and then went on to revascularization. And the cath lab program for Mended Hearts has just been a godsend for my family and for all my patients. It truly is one of those matches made in heaven.